Carrie, Planned Parenthood is one of the largest abortion businesses in the country, and it gets millions of taxpayer dollars each year. They're frequently the target of pro-life criticism. Why?
Well, I think it's the taxpayer dollars. I mean, you're talking about federal, state, and local dollars that should not be going to support the abortion industry. That really crosses a moral line for millions of Americans who oppose abortion and don't want their tax dollars going there. Yet Planned Parenthood receives, as you said, millions of dollars each year. And we have to remember again that Planned Parenthood is the largest abortion seller in the nation. Its number one moneymaker is abortion. Our tax dollars should not be going to Planned Parenthood.
So when we talk about tax dollars going to them, does that mean that that money is funding abortions?
Well, it's not supposed to be. Our tax dollars are not supposed to fund abortions directly, except if there's a rare case that a woman qualifies for Medicaid and her pregnancy happens to be the result of rape or incest or her life is in danger. In those cases, there is a way to do that with tax dollars. So the tax dollars that go to Planned Parenthood are supposed to really be used more for their day-to-day operations. But regardless, that means our tax dollars are keeping the abortion business open, and that really frustrates a lot of Americans.
If Congress were to defund Planned Parenthood, what would happen to their non-abortion services?
Well, that's a good question, and it's one of Planned Parenthood's top talking points when they want to argue to keep their money is what will happen to women, low-income women who receive non-abortion services if they have to close their doors. Well, the answer is those women would go to nearly 8,000 federally funded health centers that already exist, that are already available, and these health centers are paid for by our tax dollars. They also provide the same non-abortion services like prenatal care and cancer screening that Planned Parenthood does, but they do more than that. They have a much broader range of services, including lab tests and x-rays, dental and mental health services. So really, the taxpayer is paying twice. We're paying Planned Parenthood to do abortions, in essence, keep them in business, but then we're also paying for this network, much larger network of federal health care centers that do more services than Planned Parenthood, and they also don't do abortions. So that's really key.